As the mercury drops, you may lose interest in caring for your skin, but it's just as important during winter months as it is in summer. Hi, I'm Rebecca Brayton and welcome to WatchMojo.com, and today we'll be learning about eczema and winter skincare. So what is eczema exactly?
Eczema is an inflammatory skin condition that can show up for different reasons. There's different subtypes of eczema. One of the biggest one is what we call atopic dermatitis. And another one that you were interested in is the winter eczema, which is due to dry skin. The atopic dermatitis is a genetic condition that creates a very dry skin from the infancy, and that is associated with other problems like asthma and allergic rhinitis.
What does it look like?
There's redness, there's scaling, but it's a fine scale. Contrary to other skin disease. In some type of eczema like the atopic dermatitis, the localization of the eruption is going to help. For example, in very young children, they will tend to have their eczema on the cheeks, the chin, the forehead, as well as on the outer part of the arms and the thighs, for example. As they're getting older, it's going to move in the creases. That doesn't mean that they can't have it everywhere, but those are the specific places. So that helps in the diagnosis of atopic dermatitis. The genetic background also helps you putting the diagnosis, as well as the recurrency, the fact that it comes back, you know, the fact that there's ups and downs. And if on top of that the child has also asthma problem or allergic rhinitis, then you're clearly into that triad.
How does eczema differ from regular winter dry skin?
If we try to get more into the subject of the winter's itch or the winter eczema, basically what you take away from your skin, you have to give back. So in countries like Canada, where we have harsh winters, where we heat the apartments, we dry the environment. As soon as you have a decrease in water content, you're going to start seeing the dryness of your skin. You're going to start seeing the flaking. And if you still don't do anything about it, then you're going to start scratching. And then you're going to start having eczema. So basically what you have to do is moisturize your skin and help her go through the environment that your skin is living in, which is the dryness, due to the heating, due to the soaps, due to the detergents. If we go back to the atopic dermatitis, it's different. Of course, the environment is going to make them worse. If they live in a dry environment, the pollution, perfume products, everything is going to make them worse. Stress is going to make them worse. And they're dry no matter what. So they still have to moisturize year-long. And then we have to introduce medication when they're having, you know, flare-up of their eczema.
What ingredients should we look for in a moisturizer to treat these conditions?
There's a few ingredients that you can look for. Niacinamide is one, shea butter is another one, ceramides are another one. There's a few ingredients, and there's a balance also in a good moisturizing. There's three subtypes of elements that are needed. I would say that your doctor can help you to choose a moisturizer that applies well for you. And if not, you can always consult with your pharmacist, who's going to help you find the best moisturizer. We usually like to use creams because they have a bigger lipid content. Avoid hot water. Hot water is going to dry your skin. Lukewarm water is the best thing. The trick here, though, is when you get out of your bath, you have 3 minutes to moisturize your skin. Because if you don't do that, what's going to happen is that it's going to evaporate, and then you're going to dry again. If you can seal in the moisture within 3 minutes, you've got it.
Thank you very much.
You're very welcome.